I kind of talked about the surgery part, but can you talk a little bit about how is chemotherapy then used to actually treat ovarian cancer?
I think that's a great question, and it builds on some things that you already started to talk about, and I think I talked about a little bit before too. So, chemotherapy is a treatment that frequently we give either through an IV, sometimes through a pill, but not as often in ovarian cancer. And this is something that is a treatment that goes throughout your entire body. And so it is something that when we meet you for the first time, we're going to get to know you better and we're going to get to know kind of where your cancer is in your body. And if that cancer has spread outside of an area that we can safely go in and remove the cancer from a surgical perspective, then we may start with chemotherapy before. And that with the hope that this chemo is going to get to all those cancer cells and it's going to start killing those cancer cells, with the hope that if it's something that we can't safely remove with surgery, that the chemotherapy will shrink that and get it to a point where surgery is possible or safe. We often will do surgery first and go in and take out anything that is safe to take out. But as you mentioned, sometimes we do have to leave small bits of tumor behind because it's not safe to take them out. And then we do give chemotherapy afterwards, either for small tumors that we can see, or even for microscopic cells that we think are left behind, even if we can't see tumors, because we know that the chemotherapy goes to all of the cells in your body and that it specifically targets cells that are dividing very quickly. And we know that cancer cells divide very quickly, which is why chemotherapy works well to kill cancer cells. There is one other form of chemotherapy that we sometimes use specifically in ovarian cancer, where we put the chemotherapy into the abdomen. And this can be used in two different ways. Sometimes we heat it up and put it into the abdomen at the time of your surgery. This is called hot chemo or heated intraperitoneal chemotherapy. Sometimes people will abbreviate this HIPEC. And then sometimes we give it in combination with chemo through the IV after you've had your surgery, because we have trials that tell us that if we can safely do that, that may help you in the long run in keeping your cancer from coming back.